Hello, good afternoon. Good afternoon. Please, if you can hear me, let me know that you can hear me. We're about to start.
Good afternoon. I can hear you.
Thank you very much. Good afternoon and welcome. My name is Sokoga Akubo. Today we have Dr. Lawani, a pediatric orthopedic surgeon, educate us on knee deformity in children, and Blount disease, which is a cause of bowlegs, as a result of bowlegs, is a condition found in children that affects the growth plate around the knee. The disease causes the growth plates near the inside of the knee to either slow down or stop making new bone. So this session will be recorded and uploaded on Cedar Crest Hospital's YouTube page, so it's accessible at any time. Thank you again for joining us. And now we'll have Dr. Lawani take over from here. Thank you.
Thank you very much, Sukoga, for that wonderful presentation. Done 50% of the talk by telling us what Blount disease is. Apologies, my video is just not coming on. So I'll just go ahead and share my screen and then start. Okay. Yeah. So today I'll be talking about bowing knee deformities in children. My name is Olukemi Lawani. I'm an orthopedic and trauma surgeon. I work as consultant pediatric orthopedic surgeon for the Cedar Crest Hospitals. The Cedar Crest Hospitals pediatric orthopedic unit is dedicated to caring for the bone and joint problems of children. We have been operational now for at least 10 years, and now we have a fully trained resident, fellowship trained orthopedic surgeon, myself here in Abuja, and we also provide cover for Lagos. We have a large team, and I'll talk a bit about more of what we do in a little bit. We look after children from the age of 0 to 18 years, and we look after young adults with problems which have started in childhood, presenting either because they were not previously recognized or not treated. We run 2 clinics each week on Tuesdays and Thursdays from 12 to 4:45. We have surgery days on Wednesdays, and we provide 24-hour emergency care. We have ICU care with a dedicated specialist nurse practitioner who would look after our children post-operatively, look after the casts and so forth. We have specialist anesthesia team with fantastic expertise in multimodal pain management. So the children are very comfortable after surgery, and we're able often to get them home in very good time, even after very major procedures. We have a gait analysis and rehabilitation team, which comprises our senior orthotist, Franklin, our senior physiotherapist, and myself as the orthopedic surgeon. We work to treat all the children that come to us according to the best international guidelines available. Now, by way of today's talk, lots and lots of children have bow legs or knock knees. And parents often have a lot of anxiety about how long to wait for the knees to straighten. This becomes even more confusing because they can often point to relatives or friends who have had bowed knees also straightened. So this short talk is a guide just to teach you what you can safely wait with, how long to wait, and what must come to hospital and when. And it does not replace the need for you to contact your doctor. Now, there are normal changes that we see in the knees of children. When children are born, they tend to have a tendency to have very slight bowing, the cute one that we see in babies as they start toddling around and walking. And this persists up to the age of about 2.5 years, by which time the tendency is to naturally have the knees straighten out, such that by the age of 5 years, most children actually have very slight knock knees what we call K-legs here in Nigeria. And again, the knock knees or K-legs start to slowly straighten out, such that by the time they're about 8 years, we've got the normal, slightly valgus or slightly knock-kneed appearance that they will carry on into adulthood. So when should you begin to worry? Or more importantly, when should you see your doctor? When you have any child who has new onset of bowing, when they were previously normal being that they previously had straight knees, when they have bowing that is just on one side, when the bowing is very obvious, and when the bowing appears to be worsening significantly and quickly, what will your doctor do? Your doctor will start off with a history. We need to find out if there are other family members who have had similar and how this has progressed and resolved, or if it required treatment. We need to check the degree of bowing these children have and document it so that we have a baseline for comparison for the future. We need to take bloods to have calcium, vitamin D, phosphate, alkaline phosphatase, and albumin checked. And if there are any deficiencies in these bone-forming substances that I have mentioned above, the calcium, vitamin D, and phosphate, then these are treated with simple medications to correct any deficiencies. It is important to obtain an X-ray of the whole limb, starting from the hip to the ankle, because sometimes children have bowing that appears to be around the knees, but is actually coming from the hip joint. And if and when appropriate, your doctor will advise on appropriate correction or monitoring, depending on the degree, the severity, and the cause of these bowlegs. Now, Blount disease is a form of bowing of the tibia. The tibia is the leg bone, which is relentless, and if it is left untreated, it can cause severe damage to the bones of the leg and eventually the thigh bones as well, and it can seriously damage the joint. It is common in persons like us who are of African descent, and often it can run in families. It is easily spotted on serial X-rays, which is a fortunate thing because it means that when we pick it up on time, it can be amenable to simple operations to guide growth if detected early. Early now being before 3 years of age. It unfortunately, however, has a very high recurrence rate, and such children must be monitored until they hit skeletal maturity, which is about the age of 15, 16 for most children around here. We do not know why children have Blount disease. However, there are some factors that tend to occur commonly in many of the children who have Blount disease. These include obesity. Most of the children who present with Blount disease are obese. Often there's been a history of early walking. Many of them are girls. And like I mentioned previously, many of them are children of African descent, regardless of where they live or what nationality they have. Once they have that African descent, then there is the risk of having Blount disease. And often there's been a previous history of something similar in a sibling of the child or even the parent. It is thought that there's a possible mineral deficiency that may be underlying Blount disease as well. Based on the age at which children start having this progressive bowing of the legs, Blount disease can be classified into 3 main types. In children who start progressive bowing of the legs around the age of 2 to 3 years, we say this is the infantile type. In children in whom the onset is about 4 to 10 years of age, we say it is the juvenile type. In children who have the onset in the early teens, we say it is the adolescent type. Now, this classification is academic largely because the important thing is to pick it up as soon as such abnormal bowing occurs and to present on time. This is a picture showing a young person with Blount disease, and we can see how bold these legs are. And imagine this is just this person standing. How much more difficult would it be for such a person to then try to walk around, or even worse, to try to run? Who needs an operation for Blount disease? When we have progressive bowing of the knees, despite having corrected the blood levels of vitamin D and calcium where they are deficient, where we begin to have the risk of joint damage with untreated deformity. Very obese children as well may need an operation earlier because their weight loads the joint, and this can make the joints become damaged a lot earlier than it would for a much slimmer person. How do we treat Blount disease? This depends on how early the child comes. It is best to start the treatment before the age of 3 years, or at least within 6 months of onset for children who have the onset of Blount disease at older ages. There are different methods of treatment, and I will discuss the two main methods in subsequent slides. We could use guided growth, or we could opt for corrective surgery. The role of surgery really is to ensure that we protect the growth plates from getting damaged if we catch such a child before that happens, or we aid recovery of the damaged growth plates in addition to realigning the legs so that the weight bearing goes from falling too much on one side of the knee to being balanced to both sides of the knees. Now, this is a picture showing the x-rays of a child who has had the growth correction. The growth correction essentially just aims to slow down the quick side of growth to allow the side which is slower to catch up. As the moderators very kindly explained earlier, in Blount disease, this side of the knee just stops growing. We don't quite know why, but what we do know is that if we catch it on time and we put in this little staple called an 8-plate, it allows this side to recover and the leg just straightens out magically over time. And the kids may never need any more operations after that, or even if they do need further operations, things are a lot better and the surgeries they require are a lot simpler. Now, this is an x-ray of another much older child who has presented quite late after the onset of Blount. And here we can see the bones are quite bent and they have essentially stopped growing in the leg bones. If left untreated, the abnormal shape of this knee would cause the body to bear more weight right on the inner side of the knee, and this leads to further joint destruction and the onset of arthritis in a young person. Now, in people who are presenting so late, they would be the ones who would require more extensive corrective surgery to try to straighten out the limb as shown. Like I mentioned earlier, a lot of children with Blount disease are obese. And because we know that that increased weight that is being carried around is not good for the knees, weight loss is part of the treatment for children who are overweight. Many methods of reducing weight are in existence. You would talk about exercise. The trouble with exercise is when the child is big and the knees are bowed, they're unable to run around because of the abnormality of the legs. This leaves us with diet and with weight-reducing surgery. Weight-reducing surgery has become available here in our service as well for specific children who meet the specific criteria in terms of age and weight for such. Diet, of course, is a great option, but this has its own limitations depending on how much degree of overweight we're trying to correct. Weight is a big factor in choosing treatment methods as well. And even with the same degree of bowing, there may have to be modification of treatments for children who are overweight. Now, how much time do we need to recover from treatment from Blount disease? In the case of the guided growth treatments, most children just require an overnight stay, and often many of them can actually go home on the same day if their surgeries are done in the morning. They walk without crutches, without any casts treatment, and they're fine with just simple painkillers for about 5 days. We see the wound at the 2-week mark, and we x-ray them every 3 months until we're happy with how the knees have straightened out. There is some risk of recurrence, so we have to keep monitoring these children and taking decisions as appropriate. However, the child who has had the formal corrective treatment for severe bowing will require 4 or 5 days of treatment in hospital after surgery. They need to have a full leg cast and to walk with crutches without bearing weight on the affected limb for about 3 months. We review the wounds at about 1 week, 2 weeks, and at the 6-week mark, because they are wounds that can give a bit of bother because of the degree of correction achieved. And we x-ray them every 6 weeks. We tend to take out the implants at about the 18-month mark, and there is still a risk of recurrence and shortening. For children who are obese or for children who have multiplanar shaft deformities, a frame-based correction shown in the x-rays on the right is the treatment of choice. And for these children as well, they will require about the same amount of time on admission as the children who have had formal corrective surgery. They would require initial use of crutches, and often for some of the children who present in our environment, because of how late they present, many children actually require a combination of both systems of corrective surgery. Now, it's a no-brainer to see that it's just a great idea to have people present on time. What can parents do to help protect their children? It's important to avoid forcing children to walk earlier than they are ready. So you do not need to use the jumper rules. You do not need the walkers. A child will walk when they feel their bones are strong enough to take their weight. It's crucial to ensure that children have a balanced diet with emphasis on adequate levels of vitamins and minerals. They must eat fruits and vegetables, not meat, fish, eggs, and milk, because these are their normal sources of calcium and vitamin D. It's important to allow outdoor play and good outdoor exposure, particularly because we are dark-skinned, and so the melanin reduces the degree of vitamin D that we can absorb from the sun. And so we need a longer time of sun exposure as Black persons. The sun exposure is preferably the early morning sunshine, not the sunshine at 3 p.m. or at 2 p.m., which is way too hot and can be damaging to skin. It's also very important for parents and caregivers to be observant. If a child walks in a funny manner, it's just great for you to seek advice, and we're very happy to take a look at this and to monitor or investigate as appropriate. What are our take-home points from this talk? Any child who has bowing beyond the age of 2 years should be investigated. Blount disease is easy to diagnose and is best treated early because the treatments for early Blounts are so much simpler for the child to cope with and do not disrupt either the child's activity or schooling or the family's activities as well to any degree. While recurrence can occur, the severity of recurrence is always lower with children who are treated early and treated properly. At the Cedar Crest Children's Orthopedic Clinics, we can help you with advice and management of Blounts. Please feel free to call us on 0809-515-7906 to book an appointment to be seen at the Children's Orthopedic Clinics. Thank you.
Thank you very much, Dr. Lawani. If there are any questions, this would be a very good time for anyone at all to ask them. You can either unmute and ask your question or type it in the chat box. Thank you.
Great. I don't think there are any questions. Sounds like a very well understood talk.
Okay,
Hello,
thank you
good
very
afternoon.
much.
Good
Oh, good
afternoon, everyone.
afternoon. Good afternoon,
Good
sir.
afternoon. Okay, good to be on this platform. I was invited to check. Is the doctor in the house, still in the house?
Yes, we are. Thank you, sir.
Is the doctor here?
Yes, she is, sir.
Okay, is it possible that there are a number of cases that are, well, I guess your central point is the Federal Capital Territory. There are a few cases in the neighborhoods. How can the parents, especially some less privileged parents, access healthcare for their very young ones within the Federal Capital Territory at a more moderate price? Are there such provisions? Would you like to put a word for any of such children or families? Doctor, let me hear from you, whoever would like to speak for on behalf of this throughout. Thank you.
Thank you very much for your presence and your comments. Yes, we do have provisions for looking after children who are indigent. We have had a Cedar Crest charity arm called the Giles Foundation, which is Give and It Will Uplift Someone as an acronym. And this has been in existence for many, many years as well, and has looked after quite a number of children. Through this we identify children who are less privileged and who we can treat, and we offer them everything from consultations right down to surgery and post-operative care as appropriate. The limitations of that is there is a limit to how much funding we have. But interestingly, sir, for Blount disease, I do not think that money is the primary problem that we have been having with late presentation. I feel that a lot of it sits with the cultural tendency for people to just say, oh, it's just normal bowlegs. The older brother had it, and they expect it to correct. This brings the average age of presentation for the children we see to about 5 to 8 years, which is usually 3 to 5 years later than the timing required for us to do the simple guided growth surgery that is so much easier for the child. And in every case, every single one of these families have said, oh, they just assumed it was going to correct. Sometimes they presented to other centers where they had minimal surgeries done and then had an early recurrence. And this is some of why we're hoping that teaching people and speaking to different groups of people about it will increase the awareness. Thank you again, sir.
Thank you very much, Dr. Lawani. So we have a couple of questions. And the first one, how long are children meant to be on supplements before surgical treatment is considered?
Okay, I'll just take the questions one by one. I think, and this is again, present global best practice in the European world, and I'll tell you why I'm falling back on that in a minute. I think that children should be on supplements until they're about 6 years. Now in Nigeria, you would say, oh, this is not Europe, this is not America, we have plenty of sunshine. But our children are stuck indoors because of security risk. And by the time you come back in the evening, it's too late for them to get any sun exposure. Also, as mentioned before, our children cannot absorb the vitamin D as well as the Caucasian skin because of the melanin that we have to protect us from the harsher effects of the sun. So I think all children should have supplements until they're 6 years. Now, for children who require supplements for corrective treatments, they take a higher dose of this until they are corrected, and then they should revert back to the normal over-the-counter doses until they're 6 years.
Thank you
Is
very
it
much.
fine for me to go in for the second question then?
Yes, please. Yes, you can. Thank you.
Okay, it's a long one, so I will just not read it so that we save a bit of time. But the summary of it is someone who is 29 years old, had bowlegs that got straightened while growing, now complains of leg and knee pains when she stands for too long. I think for this kind of person, it would just be good to have a clinic visit so that we see whether the legs are actually straight on x-rays and what the knee joint itself is doing. In addition to this, we'll have a clinical exam, and that would help us to be able to figure out why she's having leg and knee pains. If your knees straighten completely, then the risk of arthritis essentially becomes the same as that of the general population. The next question is from someone who speaks about a 6-year-old child who is overweight and was diagnosed with suspected Blount disease by an orthopedic surgeon who said there wasn't much to be done. Now, they have had some straightening in the past year, and they're wondering whether to wait and watch or book an appointment. I would say at the age of 6, please book an appointment as fast as possible, because we don't want to have damage to the knees from neglected Blounts. The idea of cost of simple corrective surgery, it's best to see the child first and then assess whether she needs surgery after doing a clinical exam and doing an x-ray, and then we can decide what the cost of that would be. I hope that helps. And I think that's the last question.
Yes, that is the last question. Thank you very much, Dr. Lawani. And I'd like to also thank everyone that took time out of their day to join us this afternoon. Like I mentioned earlier, this session would be available on Cedar Crest YouTube channel. So you can always go back to watch it. You can always go back to share it with other people so that you can also spread this information. Once again, thank you very much for joining us. And Dr. Lawani, any last words before we go?
Just to thank everybody for their time and for their contributions. Thank you very much.
All right, thank you very much.